Hey guys, so welcome to my channel, or welcome back to my channel if you've seen any of my videos before. I've basically put together a video a little bit about what physiotherapy is and also kind of what a physiotherapy degree entails, and then some little specific bits to Cardiff. So I just kind of clumped together all my ideas and put them into this video. Hopefully it'll help someone out there. Sorry, it's a bit all over the place, but I'm busy at the moment, so just kind of did things where I could. But yeah, I hope you enjoy it, and I hope that you learn something from it and it helps someone out there. So I'm going to kick it off talking about basically, what is physiotherapy. So the CSP, so the Chartered Society of Physiotherapists, they say that physiotherapy is a practice that helps restore movement and function when someone is affected by injury, illness, or disability. So the CSP, Chartered Society of Physiotherapy, or therapists, they're basically our professional body. So they kind of govern every physiotherapist in the UK. And as a student, you'll get a student membership to the CSP when you join university. Another important kind of group of people to mention is the HCPC. So that is the Health and Care Professions Council, and these are like our statutory regulator. So they basically make sure that we have good quality staff, and they have standards, and you can read up on all their standards and basically say that all the physiotherapists should meet these standards. So both of those groups of people are really good to go and have a look at and get a better understanding of what physiotherapy is, and also if you're going into an interview for to get onto a course or even for a job, just understanding what they do, what they're responsible for, and what they mean to you specifically is a really good thing to have a good grasp of. So going back to that definition, so physiotherapists are here to kind of treat and help people affected by injury, illness, or disability. And there's loads of ways that we might do that. For example, using movement and exercise, manual therapy, education, and advice, which is a really big part of what we do. So what do we do? So a really common misconception of physiotherapy is it's all about MSK, like the musculoskeletal system. Lots of people will experience physiotherapy in their lives. Maybe you've had a sporting injury, you've sprained an ankle, and you've been sent to a physio to help rehabilitate this. And that is a big chunk of what physios do, but there are also lots of other chunks. And if you haven't maybe experienced them in your life, you might not have that understanding. So I'm going to talk a little bit about that. So the other two areas, along with MSK, that I would consider to be kind of the larger areas are CVR, so cardiovascular respiratory, and neuro or neurological. So that's just looking at the other systems in the body that we can have an impact on and helping kind of recover from injury or disability. And then under those three, you've got your other sections as well. So amputees, pediatrics, oncology, T&O, which is trauma and orthopedics, sports injury specific, and then also kind of care of the elderly. There's loads of areas that you can work in as a physiotherapist, which is pretty exciting because it means that, if you get fed up of working in MSK, then you can start thinking about moving on to neuro. I might go into the different areas a little bit more when I talk about placements and my placement experiences, but for now I'm gonna move on. Okay, so why choose physiotherapy? Maybe you've decided that you want to work in healthcare and physio's kind of popped up in your mind. I'm going to try and give you some selling points why to choose physiotherapy. Obviously, I'm a bit biased studying it myself. So physiotherapy is a really special profession because as a physiotherapist, you have autonomy. You're an autonomous practitioner, which basically means you're kind of you're self-governed. You decide how to manage your patients. You don't get told by perhaps like physicians. This differs from place to place. So I think in America, physiotherapists aren't autonomous there. They will basically be given guidance by physicians, and they just have to put into practice what they've said. Whereas in the UK, you decide the management, the assessment, management, treatment of your patients. Another important thing to note then is making sure we use what's called evidence-based practice. So the way that we manage patients, treatment for patients, assessment of patients, is always changing. As we do more research, we're finding new ways to do things, more effective ways of doing things. So it's really important that as a physiotherapist yourself, you're going and you're having a look at the evidence and you're seeing what is the most effective way to treat my patient. We're not just using kind of old methods that might have been instilled in practice. You're actually actively updating your kind of repertoire of assessments and treatments that you can use. Another key concept around physiotherapy is building a relationship with a patient, and this is something that we're quite able to do because generally physios get a little bit more time with patients and a chance to kind of build upon that relationship and get a good rapport going, and this kind of leads into the core values you might need as a physio. So for me, two of the really big ones are compassion and empathy, having a real understanding of what your patient's going through and putting yourself in their shoes, or maybe if that was a family member, how would you want them to be treated by a physio? And that's what always really guides me when I'm thinking about my patients and kind of pushes me to, be looking into the evidence, making sure they're getting the right treatment for them and the most effective treatment for them. And also not just about the treatments you're giving, but the way you're interacting with that patient. Sometimes, so for example, in coronavirus times, which we're in at the moment, I just had a placement where I was on the wards, and a lot of these patients, they hadn't had visitors in months because they're not allowed onto the wards, which just made me think to myself, if that was my grandma, I would want someone to come along and be nice to them, have a conversation with them, have a good rapport with them, and just brighten up their day, which is something as a physiotherapist you're able to do because you've got that time. So that's something that I really treasure about the profession. So that once again kind of leads on to the next thing I want to talk about, which is patient-centered care. So the NHS kind of describes patient-centered care as involving the patient in their own care, treatment, and supporting them with decisions that they can make themselves to better their health. And it's all about empowering them to manage their health and supporting them through that. And basically just tailoring everything you do to that specific patient. Don't take a generic approach when you look to patients. Everyone is their own person. They're all going to have factors going on in their lives that are going to affect the way that they interact with physiotherapy, and that's something that you really need to consider. So that also kind of leads on to the goal setting aspect for each patient. As a physiotherapist, you're responsible for setting goals for them, physiotherapy goals, and you have to ask the patient, what do they want out of physiotherapy. If you're treating a patient on a ward, it's often they want to go home. If you're treating maybe a patient who had MS, had a neurological condition, it might be that they just want to kind of maintain their mobility. If you're treating sort of a patient with an MSK condition who's maybe rolled their ankle, it might be that they want to get back to playing football competitively. So it's going to be different for everyone, and you're going to have to take it in a different approach because of that. So next I'm going to talk a little bit about interviews. So for when you're applying to physiotherapy, you will undoubtedly be interviewed. I think majority of universities are interviewing now. And these are just some brief top tips because I could go on about this for ages. But everything I've spoken about in this video is so relevant. If you bring some of that into your discussion at an interview, they're going to really pick up on it, which is great because it shows that you have a good understanding of what the profession is. So other than that, my top tips would be stay calm. I remember I had 3 interviews. One of them was at UEA and it was my first one, and oh my god, I was so nervous, and it showed. They're not trying to catch you out in interviews. I remember I had a scenario and I was just thinking in my head, oh my god, I don't know what I would do in this scenario. And like one of the things the interviewer said to me is, what about using your phone? And I was like, obviously I should have done that. And it was just so obvious, but because I was so nervous, I wasn't thinking clearly, and I wasn't letting my personality kind of shine through, which is so important, because as a physio, you know, having the ability to be able to chat and be calm and confident and building a good rapport with people, that's a massive part of the profession. They know that you've not studied physio before, okay, but they need to know that you as a person are going to have the right characteristics to be a good physio. So just stay calm, stay collective, and let your personality shine through. Once you've got your interviews through, after you've sent your application, look at each university, look at their course, look at the number of students that they have on the course, look at their modules, look at when they go out on placement, look at where they go out on placement, how much area do they cover. All of these things are just ideas of why you might want to go and study there in particular. And even if you don't want to study, maybe like I applied to UEA, but I knew that Cardiff and Southampton, like I would pick them over. You've still got to find something about that university and just say it so that you get a place that you can have, okay? So for example, in my interview for Cardiff, I knew that, actually I think Cardiff and Southampton, I said similar things, but I knew that they were both they're Russell groups, so they're focused on research, and they mentioned research quite a lot on the open days. And I am interested in research, to be fair, but I just remember saying like, oh yeah, I love Cardiff because I've noticed how the course has focus on research, and I'm really interested in that. And I just remember the interviewer being like, oh, that's cool, like I lead the research module here. And I was like, ah, that worked out well. So yeah, just have something specific about that university. Okay, my last tip, I know they've been a bit brief, but use examples to back up any statement you make. So if you sit there and you say, I'm a really compassionate person, and then don't say anything else, they're going to be like, yeah, anyone could say that. But if you say, you know, I'm a really compassionate person, I've shown this when I did this, and it could be anything. You might not have had any work experience, that's fine. Just in everyday life, when have you been compassionate? When, you know, have you gone to a care home and helped with the patients? Have you done volunteering in some aspect of your life? You know, on a sports team, have you helped someone who might have been struggling, or anything? You know, use an example, but don't lie. Just don't lie. If you haven't got an example, go and do something to get an example, okay? Just don't lie, because they'll catch you out, and you don't need to lie. I'm going to talk a little bit now about physio at Cardiff specifically. So I'm just going to go through what you kind of do in each year, and then my thoughts about studying at Cardiff. So the first year, I haven't gone back and looked specifically because I didn't have time, but what I remember is we basically learned all of our key practical skills. We went over anatomy, we went over physiology, and we had a module that touched on professionalism. So that was kind of the bulk of what made up first year. And then you have like a mixture of assignments throughout that. What shocked me, not shocked me, but what I wasn't as prepared for coming onto the course was learning how to do kind of academic writing, which I had no clue. I remember our first assignment, and the notion of having to, every statement you make, having to back that up with a reference. I was like, oh my God, this is ridiculous. Surely people don't do this, but people do it. And you will, don't worry, persevere, you will get used to it with time. So then in second year, we went on to look at specific pathologies, which are basically conditions, and it was broken down into the 3 core areas. So MSK, musculoskeletal, CVR, and neuro. So we just kind of did the general ones. So for neuro, we did stroke, MS, and Parkinson's, because they're kind of like quite prevalent. And then I think we had 7 of them for CVR. We kind of looked at asthma, COPD, pneumonia, stuff like that. Bronchiectasis was in there, cystic fibrosis, and then for MSK we had quite a few more. We had we looked at ligament ruptures and strains. We had whiplash. We had lower back pain. We had shoulder impingement, just kind of the most prevalent conditions that you're likely to encounter on placement. And then those went into our practical exam which was like quite a big exam called PSPE, which was essentially an exam where you go in and it's like a fake placement, but with lots of questioning, and it's quite scary, but you'll get through it. I failed. I don't do well under pressure. So just don't worry, you know, if you have a setback, don't worry. Like, I went on to then do fine the next time and I'm still here. So that's a really important point. Like, throughout your kind of learning journey as a physiotherapist, you will have setbacks. We all experience them, but just persevere, and you'll get there in the end. So other things we did in second year, we also looked at speciality areas. So we did, I remember our module on paediatrics, which I really liked. I'm quite interested in paediatrics, so that was quite cool. And then we started placement. So in February, we went out on our, it was March. On March, we went out on our first placement. And yeah, so I'm going to talk a bit about placement now. When it comes to placements, Cardiff, well, for my year, it might have changed now actually. So that's something to have a look into before you apply here if you're planning to. But for my year, we have 4 placements in second year and then 4 placements in third year, no placements in first year. And they basically did that because they didn't want you to go out in first year on placement and just not really know what was going on, because you don't really have a clue in first year. Well, I didn't anyway. And it means that you can jump straight into getting involved, getting hands-on in your placements, not just standing around watching people, which I loved, to be honest. But it did mean when kind of coronavirus hit, we were way behind with all of our placements, which was a bit of a bummer, but no one could have predicted that. So when it comes to choosing your placements, you do have a little bit of choice. You're basically guaranteed to have 1 placement in all of those core areas, so a neuro one, a CVR one, and an MSK one. So that takes up 3. And then I think they try and actually get you 2 in each area, but I'm not sure if it's guaranteed. And then you get to have a choice. So for us, they sent through a survey, and it like a online survey, and it basically said, you know, pop your preferences down. So I think I put paediatrics for first place, and then I think I put amputee and chronic respiratory. But that's when kind of the speciality areas come into it a little bit more, and you start to think, oh, maybe I want a placement in women's health. I don't really know what that's about, or maybe I'd like to look a bit more into oncology, or maybe I'd like a cystic fibrosis dominant one, you know? So that's when you start to think a little bit about where you might be drawn to working as a physiotherapist. So I'm going to try and talk a little bit now about third year, but bear in mind, what happened for me and for my year is we got taken off placement in March early. So it was our first placement. I only had 2 weeks, or 2 weeks and a couple of days. And then, you know, we all got packed off home because of coronavirus, and then we didn't come back until October, I think. So I essentially only had 1 placement in my second year, which means that they've squashed the 7 placements now into my third year. So for me, it's different, hopefully different for what you will all experience. It's very stressful and very squishy, but that is not the norm. But in third year, what you would normally do is have 4 more placements. You would do your dissertation, and you would also have more modules on professionalism and complex care. Throughout second and third year, all the assignments that you do and exams that you do, PSP is kind of the last exam. The rest of them are just assignments. They are put towards your final grade. Third year is weighted more heavily than second year, and also placement grades, all placement grades go into that final grade. So I've mentioned a few things about Cardiff and why I chose Cardiff specifically, because of kind of that research factor, because of the way the placements were formatted, although that might have changed now. I did a whole other video on the pros and cons of Cardiff University as a whole, which it was quite pros dominant. I just really like Cardiff. So that's why I chose to come here. Since being here, some more kind of factors to consider. I would say that the staff at Cardiff are really good. Like, you're always going to have some that maybe aren't as good as others, but you have that in every school. Like, you always have your teachers that you're glad that you get and the ones that you're not. But yeah, the staff at Cardiff are, from my experience, have been exceptional. They're so keen on making sure that every student gets that learning experience, and they're always on site to help you out. The programme lead kind of that we've had in my year has been amazing, really supportive of all the students, and they've just changed programme leads now, but I also know that the next programme lead is also really great, really supportive as well. So something maybe not as positive is the large cohort size. So I think my year started off with maybe 150. I think it's come down maybe 120, but over 100 students in each year, which is a lot if you think about other places. So I remember looking at Bournemouth, and I think there was like maybe 20 to 30 in a year, so significantly reduced. And it doesn't have that much of an impact because you still get broken down into groups, so like your practical groups, and you still get that. So there'll be, in a practical group, I think that will maybe be about 20, so you still get that kind of closer knit teaching experience. You get given a personal tutor who kind of looks after you throughout your 3 years, so you always have someone to go to if you're struggling with stuff. So yeah, I think Cardiff was just, it's a good university, it's ranked highly, so they wanted to make sure they could get as many students in as they could, which is why the cohorts are so big. Another point to mention is about going on placement. So also when I joined, I don't think it's the case anymore because I think Swansea have started doing physio as well, but don't hold me to that. But basically Cardiff had essentially the whole of Wales to send their students out on placement. So they had a lot of placement opportunities, and Wales is broken down into health boards. So you've got like Cardiff and Vale, Nara and Bevan, Powys, loads of different health boards basically, and you get sent to a different one for each placement, or you can be in the same one. But it means you get to travel, you get to explore Wales, and the university funds your accommodation when you're away. So one of my placements was in Mid Wales, so North Powys, and you can basically ask the uni to sort your accommodation out for yourself, or you can sort your own accommodation out and then they will refund you the money. So it ended up quite well for me and the other group of students who were in the same area, because we could afford within the university budget this lovely Airbnb, happened to have a hot tub, but yeah, it was really nice, and it was well within the university budget, so we didn't feel bad about it. But yeah, it's just nice being able to explore Wales on your weekends and have different experiences. Okay, so I'm going to finish up there because I've been talking for so long, but I was going to talk a bit more about placement, but I think I might do a different video on that if that's something that people are interested in, and I'll do it after I've had my level 6, so 3rd year placements, and then I can compare the two. So I hope that someone has found that helpful. It's all my opinion. I've got nothing to do with Cardiff. I don't get sponsored to do this or anything like that. Literally just my experiences and my opinions. So don't hold me to anything I've said, but hopefully you've enjoyed it, and please like and comment if you have any questions down below.